I think it's going to be going back to the basics. And so, personally, for me, vaccinated and boosted, that's going to be my number one defense. Number two is going to be picking the right kind of mask. I go to places where I know that the ventilation is good, the CO2 levels are low. I know then in that space, I can be in that space and know that my shared air is less than 1%. I feel comfortable in those locations wearing a surgical mask. Now, I'm not immunocompromised. I've got no other health conditions, so I feel comfortable with that. But for a lot of folks, if you're having to go to, let's say, a very crowded location because you work there, that's where I think investing in a KF94 or a KN95 or an N95, getting that higher level of protection is going to be important. And then I think the most important things are still going to be focusing on our ventilation indoors. So if you do get sick, for example, and my husband got sick. He got COVID on December 29th. And so we isolated him in his room. We had all the windows open so that he was not stewing in his COVID. I always think of COVID as being kind of like a smoke, right? And so we would open the windows so that there was adequate ventilation in his room. We also socially distanced from him. When we were in the same room together, we would both wear masks. We knew our ventilation, our CO2 levels were less than 800 parts per million. And myself and my kids never got sick. And so, again, this is where basic things you can do, even if you're living with a person, to make yourself less likely to contract COVID-19. And so I can't say how important those little things are. And just even having that extra level of just insight right into where you're going. Maybe we don't want to do a holiday party this year. Maybe we shouldn't have a birthday party this year. And I know that's hard for a lot of us because we've already delayed a lot of those things or haven't seen our family for a while. But as we know, there are waves, right, to COVID-19. And so if you can delay that, or if you can limit the exposures that you have on a day-to-day basis, your likelihood of getting sick is going to be much lower.